Hi, my name's Lauren Brown. I'm a doctor of traditional Chinese medicine, clinical director of AcuBalance Wellness Center, and I'm the chair of the Integrative Fertility Symposium. And today I'm talking to Dr. Rebecca Genuis, and she is a medical doctor, and she's located near Edmonton, Alberta in Canada. So I have a fellow Canadian that I get to talk. We're going to talk about PCOS and unexplained infertility. Dr. Rebecca, can you let people know a little bit about your background? Because you are a medical doctor, but you actually don't practice like the conventional, typical GP.
Yeah, sure. So I trained as a physician. I went to medical school in Hamilton. Over the course of that time, I was really fortunate to work with one physician who was an obstetrician who, over the course of his career, had started to just realize that things weren't going that well with women in pregnancy and children's health. So we were seeing increasing rates of complications in pregnancy. We were seeing increasing rates of illness in children. So kids were being diagnosed with chronic illness. And so he was sort of shifting his practice. So when I worked with him as a student, my eyes were open to this other type of medicine that existed. And he called it environmental medicine. I think commonly today we're calling it more functional or integrative medicine. So I trained as a family physician, but since then have gone on to do a lot more training in those fields of medicine. I published a few papers, and I'm sort of very interested and passionate in working with women to help them access different types of solutions to address hormonal issues, especially around fertility.
Now, at our conference, we're talking a lot about polycystic ovarian syndrome, and I know you have a passion. You've talked to me that you treat a lot of unexplained infertility and polycystic ovarian syndrome, PCOS. And traditionally, the most common approach conventionally is kind of like an ovulation drug like letrozole or Clomid if somebody's trying to conceive. But you talk about how you can reverse these symptoms and help women regain control of their hormones. So have you found clinically that there are approaches that women can take to regulate their hormones to start ovulating naturally so they conceive?
Yeah, totally. So PCOS, I always say, is one of my favorite things to treat because women often, they're coming to me and they've never been offered anything except pills to treat their symptoms. But, I'm a conventionally trained physician. I absolutely see a place for medication, but I'll sometimes tell patients, if you have pneumonia and you come to me, absolutely, like you sometimes need antibiotics, but when you're done the antibiotics, your pneumonia is gone. But the difference with something like PCOS is if you go on the pill, as soon as you stop the pill, your symptoms all will just come back and your cycles will still be irregular. And so for me, using medications in the area of chronic illness is where I think we sometimes need to look for other options. And that's where looking for the cause of PCOS has been super exciting for helping women to discover what's causing their PCOS, which so commonly is insulin resistance, and then teaching them how they can use things like diet and supplements and lifestyle changes and cleaning up their environment and healing their gut. All of those things can really contribute to reversing insulin resistance, which then has the great benefit of reversing their symptoms and often makes fertility just a non-issue in terms of them having to use medications to conceive and grow their families.
In our 2021 IFS conference, we have several talks on PCOS, and there's lectures about the microbiome and circadian rhythm related to PCOS. And then there's about detox. So it sounds like all the functional medicine practitioners like yourself are all aligned on diet, lifestyle, detox, heal the gut, heal the inflammation. You have this analogy where you talk about PCOS as like driving a diesel engine car. I haven't heard of this analogy, so I'm curious if you could share that with us a little bit.
Sure. Here's the abridged version anyway. So diesel cars, I'm told, I don't really know much about cars, but I'm told they're sort of a very reliable car. They last a long time if you treat them properly. The same is true of someone with an insulin-resistant metabolic type. So yes, genes play a role in this. Yes, they can contribute to your predisposition to have PCOS, but they just don't predestine you to have PCOS, which is what women often get told. So a diesel car, if you were to put gas in your diesel car, your car would not drive very well. And you might end up repeatedly going to the mechanic and saying like, hey, my car it's making this noise, it's leaking this fluid, it's, clonking around, it's not braking or accelerating, I don't know. But, you might have these repeated visits to the mechanic, but if the mechanic never looked under your hood to see what was going on, then they're just going to keep sending you off and your car's never actually going to get better. Maybe you'll have a 5% improvement because maybe you really needed that belt change, but it's never actually going to really improve. this is what often happens with women who have insulin resistance as the basis of their PCOS. So often in their teens, they end up going to the doctor and saying like, hey doc, my cycle isn't regular. What can be done? And maybe they're given the birth control pill. And then in their mid 20s, maybe they go back and they say like, hey, I'm not a teenager anymore, but I still have horrible acne. So then maybe they get a cream or a pill for that. And then, maybe they're ready to have children and grow their family. So they go back and they say like, hey doc, I'm having a really hard time conceiving. So then they get, sent to a fertility clinic or put on drugs for that. And this can go on and on to things like high blood pressure and heart disease, and even Alzheimer's now is sometimes called type 3 diabetes because of its root in insulin resistance and metabolic dysfunction. So with a diesel car, if you just put the right fuel in the car, it's going to last a long time and serve you well. And that's the same thing that's often true of women who have this predisposition. If they just know how to take care of their bodies, if they know what types of foods to eat and chemicals to avoid and that type of thing, then often they will do very well in terms of their health, and they'll avoid all of these sort of repeated visits to the doctor. Does that make sense?
It does. Okay. Yeah. Take care of your body. It'll last longer and it'll work better for you. Do you think PCOS is reversible, and maybe at least the symptoms? And I kind of want to share like just some of the common symptoms. There's hirsutism, like excessive hair growth where you don't want it. There's some inflammatory conditions. You can lose lack of ovulation, infertility, cardiovascular risk. Are there any I'm missing here? Depression, anxiety.
Yeah, for sure. I mean, weight gain is just a huge one.
Weight gain is common, yeah. And so is this reversible? And are there any other symptoms that you're seeing? Because I know in my clinic, but we haven't run a study. So in my clinic, anecdotally, we're seeing women with PCOS regain regular ovulation, they manage their weight easily, hirsutism changes, acne goes away, their mood changes, their weight changes. And that's my clinic. What are you seeing? Are you seeing these things reverse with this natural approach that you're using, this functional medicine approach?
Yeah, totally. Yeah, those are common ones. Another one that's interesting, and this I've sort of found like the more people you see, you just sort of start to see these patterns like you described, right? And one of the common ones I found too is just like the sugar cravings and the crashes and the constantly being hungry or needing to snack. And that's one that, as someone who hasn't really experienced that, I wouldn't have known how disruptive it could be. But when women come back, like sometimes they just tell me like, I'm not hungry all the time anymore. And that's like this huge change for them. And so they're losing weight without ever being hungry, which is a key to knowing that you're actually getting the right diet that's customized or personalized to you and your thing. So yeah, I mean, how's PCOS diagnosed, right? Most commonly they use the Rotterdam criteria. You meet 2 out of 3 and you get a diagnosis of PCOS. So it's not a blood test. It's nothing objective. It's just, if you meet these criteria, then you get diagnosed with PCOS. So yeah, very commonly I have women who come in and then by the time they're done working with me, they don't meet criteria anymore. So can we say their PCOS is eliminated or reversed? I mean, I guess that's a little bit controversial, but can we say they no longer meet criteria? Yeah, we certainly can say that of lots of them.
And then I've heard one of your colleagues, a medical doctor, say the functional medicine approach, so the herbs, the supplements, the diet, the detox, the acupuncture, the natural approach, and then there's the conventional approach, ovulation drugs or IVF. The way you referred to it is we get patients pregnant better, the natural, and he gets patients pregnant faster. And what he means is a lot of these women will get pregnant quickly because the ovulation drug or IVF, but often they will miscarry. And so in your approach, how long would somebody expect to be under your care or to follow your program to see changes so they can have that pregnancy that goes to the birth where we have healthy mom and healthy baby? What's a reasonable time?
Yeah. And I think that approach really matters, right? I often talk about helping women get pregnant, stay pregnant, and have healthy children at the end of it. So oftentimes, honestly, women are cycling and ovulating regularly within 6 to 8 weeks. So that happens sooner. But I will generally encourage, like, let's take 6 months. Let's really deal with these things so that the change is lasting. Because, there's certain changes we make, often sort of targeting a certain insulin level, less than 55 or so. And then once women can get there fairly quickly, but in order for their insulin to stay low, they often need to sort of have a sustained length of sort of treatment or changes in terms of what they're eating to then be able to loosen up and still maintain that benefit. So I sort of often ask for 4 to 6 months, but as I'm sure you know, for women who have been struggling to conceive, as soon as it's on the horizon, they want to be pregnant yesterday. So it's always a discussion of like, what are the pros and cons, what are the risks and benefits, and then a discussion from there.
And then what is your approach? So I know you run a online 3-month program to help women regain control of their health and reverse their PCOS symptoms. Can you just outline kind of what that looks like? What are women doing to see these changes?
Yeah, totally. So I'm doing things in different ways to also just try and make things more accessible and see what's the most effective for people. So some people, all my unexplained infertility patients, and then some PCOS patients just go directly through my program. So it's one-on-one coaching for 6 months. We have monthly or bi-monthly appointments, and there's all kinds of testing and that type of thing involved. So that's one way that I do things. And then the other is through this 3-month PCOS program, which is a lot of information all at once that then women over time will use and integrate into their life. So they may not, over the course of 3 months, they have everything that for the most part they should need as a general approach to PCOS. And then they kind of filter that through, but it's done in community. So there's really interesting research that's been done around when you try to make changes in your health, if you do it in community, just the rates of success really increase. So I thought that would also be an interesting way to work with women. And I think it's interesting to do it that way too.
Perfect. So if you're looking to take care of your health and you want to have a healthy baby and get pregnant better, then check out Dr. Rebecca Genuis's website, rebeccagenuis.com. And then if you can check to see one of the professionals that might have shared this video, so they may be practicing in integrative a way, so you can check their sites out as well. And then if you're in the Vancouver area, you can check out my clinic at acubalance.ca, where we see a lot of women with PCOS. Thank you very much, Doctor.
Yeah, it's a pleasure. Thanks for having me.